Hi, everybody, and welcome to the Hanley Effect. I'm John Dyben.
I'm Rachel Docekal.
Dr. D.
Dr. D.
We're going to switch it up today.
We are. We have a really special guest.
So you are going to introduce our guest today. You've taken that from me.
I've taken the leadership role here.
Why don't you do it?
Okay. So this individual, who shall remain nameless for a few minutes, is actually one of the most important people in Florida. She is the president and CEO of our local managing entity, Southeast Florida Behavioral Health Care. But what most people don't know is that she was one of the individuals back in 2013 who helped DCF envision managing entities, which we'll talk about later, and then was the pioneer that really put together the system that today helps DCF make sure that individuals and families within the state of Florida really have what they need in terms of, in our case, behavioral health care. She is also a friend of mine, brilliant, dynamic. We were talking before this, very, very witty. And we are delighted to have you join us here today on the Hanley Effect. Welcome.
I think I'm coming back every week.
That's the witty. That's witty.
That's witty. See, that's the witty that we were talking about. It's the witty we
Who
were
wouldn't
talking
want to
about.
come back with that kind of an introduction? But I appreciate all the kind words. So thank you very much. It is very exciting to be here.
And talk to us about, let's go back to 2013, actually 2001, when the managing entities were first envisioned. But talk about the work that you did in 2013. I mean, that was really very groundbreaking for the state of Florida. And so many of the systems that you put in place are still in place today and used throughout the state. I mean, really, really exciting to have our home managing entity be the one that's really leading the way.
Sure. Some of the stuff I do is not all that exciting. And so having opportunities to kind of reflect back and think about how far we've come in the delivery of behavioral health services is really an honor, because the state as a whole has come so far. Mm-hmm. When services are provided directly under a government oversight, through their procurement policies, through the requirements on Florida statute, a lot of things take a long time to develop.
Right.
So one of the big advances, I think, is in having outsourced to the community the funding. So all of our public health, behavioral health funding, like our federal block grants, our general revenues, some local grants, all of that flows through the managing entities. And what we're able to do is really implement that in the way that the local community needs. And we can do it on a dime. So we can respond quickly to changes. We can redirect funding. And so one of the big successes is our ability to make sure we maximize the funding that's available. And that's not always that interesting, but it's really important, because you want taxpayers to have faith in the people who are empowered to spend their money. Mm-hmm. And so we take that very serious. And so blending our stewardship and the needs of our local community really makes the managing entities a really dynamic and flexible way to deliver public health services.
And we see that at Hanley. We work with 5 different managing entities, and the work that we do in communities differs based on what those needs are.
Oh, absolutely. So you really have a bird's eye view of how important it is to have that local control and that local insight to really meet what's going on, whether it's a rural or urban areas, whether there's different dynamics at play, whatever those foundational impacts are, you want to be able to put your behavioral health funding in that to support it. And another thing I think that the managing entities do really well is we complement and fill in gaps, right? So people have insurance. There's also, federally qualified health agencies, but we really are the safety net. And so we provide things like availability of services. So if you have a crisis, we have a Baker Act bed that's available for you. If you need a mobile response we have staff waiting that want to come out and help you. And so it's not always the most efficient way to deliver services, but it's a very important safety net that keeps people from getting deeper in or people getting hurt. So it's really an important role that we fill.
Yeah. Well, our guests, how many people do you serve throughout a year? This number is pretty amazing.
So we average about 27,000 people that
Wow.
receive a direct client service. So there's other services like drop-in centers or clubhouses that are not client specific, but we have documented needs and diagnoses for about 27 to 28,000 people a year. And that's for our 5-county area. So Southeast Florida serves Palm Beach, Okeechobee, Martin, St. Lucie, and Indian River counties. And so we do people who are uninsured, people who are underinsured, so sliding scale fee for income, and then also help fill in those deductibles. Because a lot of those health plans out there have really high deductibles that you have to meet before your insurance kicks in.
Right.
And so we help make sure that we get that covered so you get the services you need when you need them.
Yeah. Go ahead.
I'm just thinking about, there's so much we hear about in the news, but people I don't think hear about this. What SEFBHN's doing, and I mean, that's an enormous number of people in our home, right? This is our home. This is our community. And so the thought I just had in my mind is, why in the world we hear about every problem, but this is an organization, and the work that you're doing is directly impacting lives and healthcare every single day. And I'm just wondering, why don't we all hear more about it?
Yeah.
Probably because we operate pretty lean. So we operate on a 3.5% budget. And so meeting a lot of the federal and state reporting requirements. And you're right. And that's one of the reasons I was so excited to be able to come on and talk with you both, is a chance to showcase some of the really cool things that we do, because we don't market ourselves, right? We are a support for our provider network. Yeah. We're the go-to, we're the solution, we're the intermediary, we're the ones that are really charged with being able to make the decisions on the fly. And it doesn't leave a lot of time then to look back on your laurels and think about all the wonderful things that have happened. But that's why these shows exist, is so some of us can get out here and talk about some of the really important work we do on behalf of all of the Floridians. And this is a really great area, and we have a lot of tremendous providers, and really being able to showcase and help people navigate. I think that's probably one of the biggest things that people struggle with. So we rely a lot on our 211 system, which covers all 5 of our counties, and they have a tough job of trying to be all to everyone, but they really function for us as our front line for a crisis. They interface with our mobile response teams, and they give us a lot of input on the needs in the community, especially unmet needs. So they're a great partner of ours, just like so many of our other agencies, and helping make sure that we're training in evidence-based practice is another big function that we like to be involved with. Evidence-based behavioral health is expensive.
That's right.
And even our prevention programs, which Hanley is famous throughout the state for having high fidelity evidence-based prevention programs in our schools, it really takes a village, right? It takes everybody working at all levels. So whether we're doing prevention or deep end crisis and crisis diversion, it all has to come together for the community and be responsive. And so that is one of the things I am most proud of, that we really do want to listen. We have a community-based board, so it's representatives of the people that we serve, advocates for families. We're very, very proud of our efforts in developing our peer network. So getting individuals with lived experience certified to be able to help provide that sense of hope and engagement for individuals who are probably pretty bitter and disillusioned about a lot of things that have gone on in their life. But to see somebody who has succeeded, who's overcome jail or prison, who's overcome health complications, dysfunctional families and all the trauma that goes along with it. But to be able to actually see somebody who survived and is now thriving is so inspiring. And I feel like we've really been integral in making that a real movement. So
Right.
Yeah.
you have to learn how to tell your story, right? You have to not re-traumatize yourself, and you have to be able to inspire and instill that sense of hope. And that's what we see so much among that very specialized service of peer supports. So a lot of different things have really evolved over the last 13 years.
You know, I want to give a shout out to you and to your staff. Every time I go to a county commission meeting, you're there. I served on the behavioral health task force that the CJC had. Becky Walker, who I know has since retired, but she was there every single meeting. The opiate task force, you had somebody there. 211, you know, you really were one of the drivers behind the success of 211 and really getting it launched and the way it's deployed in our community. I can't think of a community project that either you or a member of your team has not been there, not to lead, not to take over, but to be that partner and really work to understand what the community needs and what the community wants. Will you talk a little bit about that? I don't know how you all do it.
Sure, and that is one of the roles that we serve is we have to make sure that we communicate with our other elected officials about what's happening in behavioral health. There's a lot of issues that get pointed back to behavioral health and trying to understand those root causes. And so it's important that we let our elected officials know where they can be most effective, what the needs are, and what's being done, and quite honestly, you know, some gaps and opportunities so that they can be the most effective on behalf of the people that elected them. So, you know, we work with the county commissions in all 5 counties. We manage the opioid settlement money on behalf of Indian River County. We work very closely with all of the public safety coordinating councils in the county as they work on the opioid abatement settlement dollars, which is, you know, is another huge undertaking, because how do you put those dollars into the most effective use? And so understanding what's already available, what the needs are, and what the opportunities that are out there to really make that funding effective. And that's not glamorous, and it's not readily appreciated, but it's important that we really take advantage of the time limited funding and that it goes to the communities where it can do the most good. And we're part of that in all 5 of our counties, as just as an example of how we try to keep our finger on the pulse of what's going on in all of our counties and our municipalities. And we work a lot with law enforcement. It's important for us to understand what's happening within their ranks. Right. What are they seeing, and what kind of support do they need? Because we all know that our jails are our largest mental health institutions in any county. And so trying to figure out how do we effectively serve those who are coming back into the community? How do we prevent those who are there for the sole reason that they have an underlying mental health issue? And so that's been a really important partnership. The schools, you know, working with the schools and the funding that they receive for behavioral health, and how do we make sure that we're helping them maximize and reach all of the individuals and families that need services. So there's so many points of connection that are really important that really helps build that safety net for communities. And we are excited to be a part of so many of them.
Yeah.
I mean, it's just hearing all the things. I mean, I want to take a nap. So, and what's got me thinking, and you know, your work is involved. I mean, you're watching out for the homeless person who's just overdosed, and you're dealing with politicians, and so you're the breath and all the things. So I if it's okay, why do you do this work? What got you into this? What keeps you here too?
You know, interestingly, I love bylaws and I loved insurance policies. And so when I first started coming out of school, that was a passion because it was so difficult for people to read and understand and being able to translate that, right? And so I loved selling insurance. because I help them understand why you're doing this and why you need this. And so it just kind of built from there. So then I found out I had this really weird knack for bylaws and understanding and how to build that framework. And so it kind of took off from there. And so after working, a little bit in Head Start, working with the Area
Wow.
Agency on Aging, and then ending up with the Department of Children and Families, I am not a clinician by training. I'm administration. And so it was important that I learn about the needs of programs and of clinicians in order to best utilize the funding, because it's too easy to rely on a strict interpretation and not understanding exactly what are the parameters that we can make the best use of funding. And so I just found I really had a really good niche at combining those. So when we get a budget and we've got legislative intent, nothing I like better than to making sure I understand that and how does that roll out and how do we meet that. And so kind of built from there, and nothing like a good contract. It's a lot of terms and conditions. How do we make sure that we are complying with what's expected, but also meeting the needs of the individuals? And so being able to braid and blend funding, rules and restrictions, knowing how to bend without breaking, knowing how to free people up to do the work that they love while also holding them accountable, has just been something that really has inspired me to help other people do the things that they love to do by being a good administrator.
With the entire list of your history is a list of service. All of the organizations, you could do the same thing on Wall Street and make a lot more money, and yet there's something about you that's drawn to service.
Apparently, you just kind of move along, and a lot of times you wind up in the place that you're supposed to be, and so whether it's destiny or divine intervention, there is an element of calling, and I know you both know that in the work that we do, that helping overcome human misery is just so instrumental to me getting up every morning and just knowing that there's got to be a way that I can make this a better place and maximize all the tools available to us. And so it's not glamorous, right? A lot of paper pushing, a lot of reading and developing implementation plans and monitoring and holding other people accountable, right? And making sure other people rise up to the occasion, right? Because this is not a game you can play by yourself. This really requires an all-in dedication from all of the staff. And so trying to be a good leader and a role model so that we all have skin in the game, and that we all have the expectations, and that we don't let each other down. Which is a lot about network building, right? You know who you work with, and you know what they're capable of, and so you want to help hold them up and help them reach their potential too, because that's really part of the role that the managing entity serves, is how do we help all of our providers be the very best and most responsive to the very, very diverse and individual needs of each and every person in each and every community.
I love how you said that.
Yeah.
I'm going to just let our listeners behind the curtain just a little. Your team comes out and audits our work. You take a look at, you look at receipts. You look at exactly what we're doing, how we're coding things, what the education is that each of our staff members has. I could go on and on and on. It is a rigorous process. And you do that not just with Hanley, you do that with everybody who, before you grant dollars in that direction, and then as a standard follow-up. That holding our field accountable
Right.
is critically important, because we know that there are research and evidence-based practices, and that's what we really need to be following.
Absolutely. And a lot of times it's referred to as monitoring or auditing, but we really embrace the philosophy of validating. And so our process is referred to as our validation process, because we want to come out and instill in the taxpayers, in the elected officials, that we have looked at and are holding our network accountable, and that we are doing what we said we would do. And I think we owe that to our providers, so that their credibility is established, that not only are you accredited, not only are you licensed, but you're also, we validated the delivery of services and your outcome. And so really it's important that we do a good and thorough job, because our network providers deserve to have that kind of seal of approval, that we know what's happening, we know what kind of services are being delivered, and it's more sometimes can be seen as bureaucratic, right? But it's a necessary component to having a system that's accountable and responsive.
Well, as a member of this community, we want to be sure that the care that we are receiving is the best care.
Absolutely.
So Hanley welcomes the visits,
exactly.
the validation visits. I'm going to use that word. I love that, validation.
That was beautiful.
Instead of monitoring. It is. I'm not going to tell you that we don't get nervous every single time, that we don't have butterflies in our stomach, because it's very, very rigorous. But we also welcome it, because it gives us the ability to showcase to you and to the taxpayers, the work that we're doing.
Absolutely. And it's always a pleasure. Working with the front line and understanding what's happening. And and a lot of times there's just technical assistance opportunities and ways to be more efficient, or clarification on how to achieve our mutual goal. And so I think that's some of the parts of the work that staff enjoy most, is being able to interact with those people that are actually delivering the services. And it is an honor to work with so many dedicated professionals, and it is pretty inspiring.
Yeah. Will you just talk just a little bit about the leadership that you bring to our state as a whole? I really think that this is something that's such a benefit, having you here in Palm Beach County, because you really do play such a leadership role statewide. And I know you are one of the most humble people I know. I will again share with our listeners today that you said, "Oh, Rachel, really, really, do you really want me on the podcast? What if I have some of my staff?" And I love that about you, that you are so humble. But, for other strong women out there, it's important for them to, really understand what a powerhouse we have here.
Well, and then I appreciate the kind words, but you also are very inspirational and very compelling to have stories told that maybe don't always get a lot of the attention. But I've been fortunate. I've worked in Tallahassee at the statewide level. I've worked. I continue my work on the Behavioral Health Commission, which came about as a result of a recommendation out of the Marjorie Stoneman Douglas Commission. Right. I testified and appeared before the grand jury there with recommendations, which also helped get the Behavioral Health Commission implemented. And so we continue work on that. And then we also have an association for managing entities. So with 7 individuals in a room, you can touch all 67 counties and know the behavioral health needs, or what's happening or what's trending in the entire state. So I'm very active in working with that group to bring about best practices and how to work more efficiently. And so it's always a learning opportunity and kind of that give and take, and being able to continually refine what we're doing, make it more productive, and meet the intent that we all want with behavioral health services. Right. And Rachel, very much to your point, we want services that we would have our own families served through. So that's kind of the backdrop, and so it's nice to be able to go up and testify before legislative committees and help them understand how they can better define the rules and requirements. So I frequent attendant up in Tallahassee before, during, and after session. And then, working with our local legislative delegation is important, because it is advocacy. It is truly helping them understand how to make a difference in their jobs. And so to be taken seriously in that element is also very rewarding to see, ideas and things that we know to be better practice actually turn into law is a compelling case to keep going back up there. And so keep looking for opportunities that we can have an impact statewide, whether it's, disaster preparedness and what do we do when a crisis occurs, right? How do we respond? How do we support the community? All the way to, what is the best way to allocate resources and how do we do that? So being able to have a influence over that is important, and making sure that, there's a balanced perspective and not the last voice or the loudest voice is the one that's adhered to. So I like to be very persuasive and persistent and make sure we get a fair shake, and that if somebody, a lot of time legislatures say, I don't know anything about behavioral health. It's like, well, let me tell you, let me help you understand how you can do your job better, and let me be a resource for you. So I try to make them put me on their contact log right in their cell phone under behavioral health needs. So when they have a constituent, when they have a question or an issue, that they've got me on speed dial, that they can just get right through. So making sure that's a tactic that we use to make sure our legislators can't say they didn't know.
Yeah. And it's a big part of our budget. Yeah. I mean, a lot of dollars go to behavioral health.
It is.
But, when we look at the work that you and the other managing entities are doing, so much of it is prevention and, other services that are really keeping somebody from having a much, much worse experience down the line.
I think about 211. And I think, you describe kind of, it's not glorious and the things that I do sometimes, but, and you're so behind the scenes, but it's so, and this is the first time that, we've met before, but this is the first time I'm ever sitting and listening to you, and you love what you do. I mean, I can feel it. If anybody's getting, I'm sure you can hear it, but you clearly love what you do. And I love, sometimes I had someone say to me something, and they were doing managerial and accounting kind of work. And they were like, well, I don't do the important stuff. I wish you do the important stuff. And I think about the person tonight who's going to call 211 and who's going to get help because of all that behind the scenes work that you do. And so, I think that's an important thing for people to hear, that you don't have to be the therapist. You don't have to be the provider. You don't have to be the doctor. There are all of these things are so important. And it's such a beautiful example of the real life importance of being passionate about, the things that maybe people won't see as much in the spotlight. And I have to be the bad guy.
Yeah. Oh, he's always the bad guy.
And we're coming to the end of our time. And what we love to do is I have so many more questions.
I know, I do too.
This happens every once in a while.
And I know you'll say no, but
but we like to give you the last word, and thinking about, and actually better than anybody, like the breadth, there's a wide variety of people that listen to this, and these are people, who sometimes are in mental health, sometimes they're not, sometimes they're in recovery, sometimes they're not. But to the people who are listening today, what would you like for them to hear from you? If you could say one thing.
The theme that we've really been addressing is navigating the system. And I always hear how complicated it is. A lot of times parents for the first time are dealing with a child with some kind of a behavioral health issue, and they don't know where to turn or what to do. And my heart just breaks for them. And so while we are continually focusing on how do we improve outreach, how do we better communicate, we've already talked a little about 211, but don't give up hope. There is somebody out there. This is an amazing community. We've got a lot of advocates that are talking about things like mental health first aid as a front line. We're looking at a lot of different screening tools and ways for people to be able to get into the system. And so I hope that people don't give up, that we get the support and help that you need, that we find a way to help navigate. And peers, our certified peer specialists, do such an amazing job at instilling hope. When you can see somebody who's overcome exact kinds of things that you've encountered in your life, in your depths of despair, in where you question the reason to go on, and they can say, I've been there and I've done that, and I'm here to tell you there is more to this life than what you're experiencing right now. And I take our role as helping make those doors open very serious. And so that's one of the things that we continually focus on is how do we get you the care that you need, and how do we make sure that when you're ready, we're ready. And those are the things that I continually focus on, and that's what makes me want to continue to improve the system, to maximize all of our resources. And I have to say, I enjoyed this way more than I thought. So I appreciate you all are very engaging. So for any future guests who may be a little reluctant, I can give a hearty endorsement that it's not so bad, and actually it might actually be a little bit fun.
Well, I will tell you, in all that we've been doing this a long time, you are the first guest that ever gave us an endorsement as the last word. All right. But that last word of don't give up hope. Yeah. There is hope is so critical. Thank you so much. I am so glad that we got this time as well, because it's rare to see someone as passionate and just who loves this work and cares about this community that is our home. Yeah.
Thank you. You're amazing.
Thank you. Thank you. You're too kind. Thank you.
Thank you, Dr. D. Glad to be here.
Thank you, Dr. D. This was fun today.
This was a lot of fun. And I want to say thanks to everybody who is listening and watching. We will see you next time on The Hanley Effect.
Bye, everyone.
Thank you for joining us for The Hanley Effect. To learn more about our programs, visit hanleyfoundation.org or call 844-502-4673.